Following the emergency use listing last week, the SAGE group met today to discuss policy recommendations for the use of the Pfizer vaccine. I would like to invite the chair of SAGE, Dr. Alejandro Cravioto, to tell us about the recommendations. The floor is yours, Alejandro.
Thank you very much, Mr. Director General, and a Happy New Year to you too. The Strategic Advisory Group of Experts on Immunization was established by the Director General in 1999, and it's comprised of 15 experts from around the world charged with providing independent advice to the WHO DG on all policy-related issues of vaccines and immunization. The group is very well balanced geographically and gender-wise. In June of last year, as we do with other vaccines, SAGE set up a working group for the COVID-19 vaccines that were being developed. The group consists of 26 experts from around the world in all different areas and have consistently been working for the past months at least 2-3 times a week to be able to help us develop a number of documents and issues that we have been reviewing at SAGE level. The first product of the working group was a values framework for allocation and prioritization, which was presented to the DG and approved in September of 2020, and then a roadmap of prioritization for the group that should be set up for vaccination, which was also approved and disseminated in October of 2020. These documents have been translated to all the UN official languages, or the WHO official languages. And today we met to look into the approval of the WHO emergency use listing of the Pfizer-BioNTech mRNA COVID-19 vaccine. The meeting was initiated with a review of the current situation of the COVID vaccine development pipeline, and of course the issues related to these SARS-CoV-2 virus variants, which is something that is worrying everyone. We looked at the global, regional, and country level plans for COVID vaccine safety monitoring, and we looked at the safety and efficacy data from phase 1 to 3 clinical trials of the Pfizer-BioNTech mRNA COVID-19 vaccines, BNT162b2. This was presented by the Pfizer and the BioNTech experts, and was discussed by the SAGE members and the members also participating in the session. We deliberated and came out with the following recommendations. SAGE recommends the administration of 2 doses of this vaccine within 21 to 28 days. While we acknowledge the absence of data on safety and efficacy after 1 dose beyond the 3-4 weeks studied in the clinical trials, SAGE made a provision for countries in exceptional circumstances of vaccine supply constraints and epidemiologic settings to delay the administration of the 2nd dose for a few weeks in order to maximize the number of individuals benefiting from a 1st dose. In the case of the anaphylactic reactions after administration of the Pfizer vaccine that have been reported outside of the clinical trials, SAGE recommended that the vaccine should be administered only in settings where anaphylaxis can be treated. So we provided a specific narrow exclusion for vaccination and on the observation period, as well as the management, monitoring, and reporting of any safety events. We recognize the importance of vaccination of pregnant women, especially given the priority for protection of health workers, of whom a large proportion globally are, of course, women. Nevertheless, in light of the data limitations, SAGE was not able to provide a recommendation for the use of the vaccine in pregnancy until more safety data are available. However, we made a provision for situations where a benefit of vaccination of a pregnant woman outweighs the potential risks, such as health workers at high risk of exposure. We have done this before for other vaccines, as the use of the Ebola vaccine in the Democratic Republic of Congo before. SAGE acknowledged the lack of data for recommending the vaccine to lactating women, and given the importance of breastfeeding, we encourage the companies to be able, or the company to be able to bring information necessary for us to make a decision in the near future. As with the case of the pregnant women, we have also made a provision in which if a woman is part of a high-risk group, then we recommend the vaccination without the stopping of the breastfeeding. In the case of persons SAGE recommends that COVID vaccination be offered regardless of a person's history of asymptomatic or symptomatic SARS-CoV-2 infection. Available data currently indicate that symptomatic reinfection within 6 months after an initial infection is rare. Thus, in the context of limited vaccine supply, persons with a PCR documented SARS-CoV-2 infection in the preceding 6 months may choose to delay vaccination until near end of this time period. This would encourage the use of the vaccines for other people who have not been exposed to the virus and thus have a much larger portion of the population protected. As noted in the prioritization roadmap, SAGE re-emphasized that national programs should take specific steps to identify groups that are proportionally affected by COVID-19 and those who face health inequities due to social, structural inequities in order to address barriers to vaccination and achieve equitable access to the products. In the current period of very limited supply, preferential vaccination of international travels would counter the principle of equity. Because of this and the lack of evidence to inform whether vaccination reduces the risk of transmission, SAGE currently does not recommend COVID-19 vaccination of travelers unless they are also part of a high-risk group identified within the prioritization roadmap. SAGE recommends the continued post-authorization monitoring of COVID-19 vaccines for effectiveness and safety, and listed multiple specific areas of additional research on COVID-19 vaccines, such as vaccine efficacy against SARS-CoV transmission, duration of protection, vaccine efficacy against the virus variants, vaccine efficacy and safety in children younger than 16 years old, immunogenicity and safety, and especially co-transmission with other vaccines and vaccine interchangeability. This is important, especially with the co-administration for the elderly group with an influenza vaccine, if that were possible. In the coming weeks and months, we will continue to review the other vaccines as they become available, and with the data coming from the manufacturers when made available for these deliberations and as part of the regulatory processes are undertaken. The recommendations have been sent to the DG for approval, and once this has been achieved, then we will publish them in the weekly epidemiological record in a few weeks so that everybody is aware of this first approval of this COVID-19 vaccine. I would leave it there, sir, and see if there are any questions that somebody would like to ask. Thank you very much.
Muchas gracias, Alejandro.
De nada, señor.
Every country needs to row in unison in the same direction to beat this pandemic. Solidarity, multilateralism, and collaboration are key so that we win the race against this pandemic quickly and escape these stormy waters together. Lastly, over the past 24 hours, members of the International Scientific Team on COVID-19 virus origins began traveling from their home countries to China. This was as per arrangements jointly developed between WHO, the Chinese government, and the countries for which the team was meant to travel through on their way to Wuhan. Today, we learned that Chinese officials have not yet finalized the necessary permissions for the team's arrival in China. I'm very disappointed with this news, given that 2 members had already begun their journeys and others were not able to travel at the last minute. But I have been in contact with senior Chinese officials, and I have once again made it clear that the mission is a priority for WHO and the international team. I have been assured that China is speeding up the internal procedure for the earliest possible deployment. We're eager to get the mission underway as soon as possible. I thank you, and once again, Happy New Year.
Hello everyone. HW News English is 2 years old now. When we started this venture, we promised ourselves one thing, that news should remain free, because right to know is the right of every Indian. But to keep news free for everyone, we need support from some of you. And thus we have rolled out membership on our YouTube channel HW News English. But mind you, the membership is completely voluntary. The programs that we were doing earlier, that we are doing now, will continue to remain free. First level is a basic level. Here, you can be our supporter by paying rupees 199 per month. This membership gives you certain perks and benefits. The perks include unique badges in front of your name, a live show from Mr. Sujit Nair and from Mr. Akhilesh Bhargava per month for our members. You can also vote in some exclusive members-only polls. Now the second level is Super Supporter. Here you can be our Super Supporter by paying rupees 3,999 per month. This membership will include every perk that comes with basic level. Additionally, our Super Supporters can be a part of a WhatsApp group where we can have discussions and suggestions on various topics. The second perk includes a gift pack with our merchandise. And the third perk is a Google Meet with Mr. Sujit Nair, where you can join the meet and ask your questions to Mr. Nair face to face. Lastly, if you like, we would give a shout out to our super supporters in our programs. So, hope to see you soon with our badges.